the place you wanna be. Teamwork, work skills, and the people are friendly. You have a lot of fun, 'cause it's hands-on. It's worth the drive, 'cause it's the start of your life.
Welcome to our newest edition of This Week at WACC. I'm Jerry Bender, your host, and today's show features Allied Health with our guest, instructor Julia Burhow, and our student, Allie Lyons. So, to start this thing off, we've talked so much about our different programs and different things. The thing that fascinates me the most is the career opportunities afterwards. And Julia, you've taught Allied Health for, you said, 10 years now?
Well, I've been at the Career Center this is my 10th year.
Teaching all kinds of wonderful courses over there. So tell us about Allied Health.
Well, Allied Health is a one-year program, and juniors or seniors can take it. And anybody interested in the medical field is more than welcome to take the class. Usually, if they want to be in the program 2 years, we have them start with Health Occupation CNA and then go on to Allied Health. But if students aren't interested in the nursing field, then we actually can take veterinary, dentistry, any other areas of the medical field. Students can sign up for a class.
So now, Allie, you're in Allied Health right now, but this is your second year in the program. What got you interested in taking the program at WACC?
It all started when I wanted to be a CNA. I've always had an interest in the medical field. So when I saw the opportunity of Morrison that my school offers a CNA, I can actually go there. So I took that opportunity and then passed that class. And now I'm here learning about the medical terminology of basically going into nursing, because that's what I want to do.
Okay, so before you came here as a junior, had you already decided that you thought nursing was the career path you were going to take?
Yep.
So get your CNA first, give you some job opportunities maybe there. So what happens now after you're done with this class and you get your A from the class and you're feeling pretty good about being a nurse someday? What are you going to do next year?
I'm working as a CNA right now. I'm going to work as a CNA for a couple more years, get the hang of everything, and then I'm going to start college and start my nursing.
Terrific. Okay, so Julia, hopefully we're talking to some future students over here, and what are the advantages? Somebody wants to be a nurse. What are the advantages of coming over to our place or just kind of going to college on their own after they graduate?
The advantages are the students get dual credit from SOC. They get high school credit and dual credit. So like with Allie last year taking her health occupation CNA class, she got 8 credit hours from SOC, and then this year she'll get an additional 5 credit hours with our medical terminology, which we're taking this fall. And then in the spring we're going to be taking a pharmacology class, which is new this year. And so they get a leap on their college credits, and they can almost knock out a whole first semester of college and be well on their way to getting their nursing degree.
The medical profession changes all the time. This year you're adding pharmacology. Why?
Well, in the past we had nutrition and diet therapy, and did that for many years, but the requirements for teaching that class changed.
Okay.
And so normally a registered dietitian teaches it, so we decided to go with a pharmacology class.
Which means what? What is pharmacology?
It has to do with medications, and it's actually for non-licensed personnel. So like CNAs and medical assistants work in doctor's offices, and they're oftentimes the person that checks in somebody before the doctor or nurse practitioner comes in, or PA. And so like Allie, if she was a CNA in a clinic, she would need to go over the medication history with the patient before the doctor came in, and so this would give them exposure to medications, doses. So that's why we decided to offer it.
I need people like that. I have a lot of medication. So, Allie, you got some friends that maybe they think about nursing, maybe they're not, maybe medical profession. You go back to your school and some kids ask you, why would you tell them to jump on board at WACC as either a junior or a senior?
It's a great start into the medical field instead of just going straight to college. You already have an introduction of everything, and there's a lot of terminology for it. You got to work hard at it, and I'll just college. We have a pretty good pace at Allied Health, and at college they'll fly by and they won't stop. They'll just keep moving whether you're behind or not. So you get a feel for it. You understand how it can be difficult. And for the CNA program, if you take it as a junior, which I did, if you don't like it, you don't have to be a CNA, and you already know that medical field is not your type of field you want to go into. So you already know it for early.
So kind of a good idea, a peek of what happens in that, because you actually do on-sites, you're at different places?
Yep.
Okay, so now my last question for you, Julia, is that we look at this kind of in the nursing profession, but in my years as principal, the change I've seen is that any kids looking at anything in the medical profession are starting to come over.
Right. And that was a change we made several years ago because, again, like Allie said, if students don't want to be a CNA, then they would just stop at the CNA program. But with the Allied Health, they can just come over by themselves and take that class the first year, or they can take it as a second year class. And so we open this up to anybody interested in the medical field. And this year I have a lot of students that are interested in veterinary medicine. And so one of the benefits of the program is they get to go out to internships 2 days a week. And so my nursing students are mostly over at CGH, and they get to float all over the hospital to OB, pediatrics, the ER, critical care. And then other students that I have that aren't interested in the nursing or don't have their CNA, they get to go to the x-ray area. I've got students in the GI lab. I've got students in physical therapy. And then those are hospital sites. But then I also have off sites where, again, veterinary clinics, dental offices, chiropractic clinics, pretty much anywhere that the kids want to go. They can choose a site, and I'll call them, and we'll try to make it happen for them.
So there you have it. That's Allied Health. That's kind of what we're trying to do at WACC as far as preparing you for that next step as you move on. Again, as with all of our programs, we want you to be successful at this level so you can be successful at the next level. If you have any questions, you have any doubts, don't hesitate to call us at WACC 815-626-5810. We'll set you up an appointment. You can come and even visit Julia's class and see what's going on. Thanks. Have a great week.